All right, so this is a question that we had. As you just saw in the previous paper, particularly in the males, there's a significant number of patients who may not respond to something like botulinum toxin, and the question is what happens next? So it was a perfect lead-in, and I'm a little awed to go after a medical student who did such a good presentation, so hopefully I can match that. All right, these are what I thought were pertinent affiliations. So again, as we know, overactive bladder treatment is generally algorithmic. You start simple, behavioral modifications, go on to medical therapy, and then go on to third-line therapy. But the question is, what happens when those therapies don't work? Where do you go next? So this specific review was to see those who had failed botulinum toxin A, Botox, which is what we use at our institution. So we specifically looked really just at a little over a 2-year slice of patients, both those who were non-neurogenic and neurogenic who had received Botox. The data points that we looked at were the dose they received, whether they improved or not, how long there was between injections, adverse events, follow-up, and then we looked at subsequent therapies. So we defined failure, and this was an arbitrary definition, but we defined failure as an unsatisfactory response after a maximum of 2 injections. So if you tried it once, nothing happened, you tried it again, they didn't improve, that was a failure. Loss to follow-up was when we had no patient contact for at least 6 months after the injection, and adverse events are as described here. So what we found, so there were 282 unique patients who underwent a Botox injection amongst our group in that 2-year period. The majority were women. Overall, amongst those 282 unique patients, there were 516 injections, which came out to about 2 injections per person. They all had to have at least 2, because that's how we define failure. Some had as many as 6, because those obviously were probably the patients that it was working, but it perhaps wasn't lasting as long. And a third of the patients had a neurogenic etiology. When we look at the demographics, you can see here whether age, gender, BMI, and neurogenic etiology, we really didn't have any difference in success or failure based on those criteria. On the other hand, when we looked at some of the other factors, time to first follow-up, if they failed, they came back a lot quicker because they probably wanted something done again. If they failed, they had a much higher chance of their practitioner giving them a higher dose of Botox at the next visit. And those who were failures in that 2-year period had a higher chance of losing contact with us. When we looked at adverse events, there was really no significant difference in adverse events between successes and failures. And then when we said, let's look at what the next step is. So unfortunately, the biggest proportion here, 39%, were those that were lost to follow-up. And we were not able to determine what the next step was, though given that they were not seeing us, either they perhaps saw another practitioner or I'm pretty confident they probably did not have another third-line therapy. Amongst those that we were able to follow up, actually the majority of those who failed Botox then went back to medication. A minority went on to sacral neuromodulation, PTNS, or things of that nature. So our conclusion is that return to pharmacotherapy was the most common next step in those who subjectively failed Botox injections, and continuing with Botox or trying another third-line therapy were less frequent options. And interestingly, the failures did not have a higher adverse event rate, but clearly were more likely to be lost to follow-up. So it's sort of counterintuitive in the sense that you'd think that somebody who gets to third-line therapy, they're probably not going to go back to medication. They've already failed medication. But indeed, that was the most common sort of next step that these patients took. Thank you very much.
Thank you very much, Dr. Gomez. Any question from the floor? So what explanation do you have for failure of botulinum toxin injection? Because there are several papers suggesting that the second injection might rescue patient and even the third injection as well.
So indeed, some of the patients may have been rescued on a second, and they would not have been considered failures. The failures were only those who failed 2 consecutive injections. And I think if you look at the data out there, overall, the success rate is somewhere, subjective success rate for Botox is somewhere in the 60 to 75% range. So I think that our numbers here were not that different from the big picture. But again, we had to fail 2 in order to be labeled a failure.
Yeah. Any question? In your setting, oh yeah, sorry, please go ahead.
Hi, I am Esther from Valencia, Spain. Do you think that the idea to return to pharmacotherapy is related to expectations that at the end the patient feel the same improvement with Botox, modulation, and pharmacotherapy?
So I think it's unlikely that they get the same response with pharmacotherapy, and we didn't study this, so I'm just giving you my hypothesis. My general sense is that they had an invasive procedure, or at least they saw it as an invasive procedure. They tried it twice, it didn't work, and at least in that time period, they said, let me just go back to an easier thing. That's my sense. Ibu.
Ibu Versi. Howard, to carry on with David Castro Diaz's question, why does Botox fail in some people? And then that would be interesting to know.
So I'll answer that one first. So that's beyond the scope of this presentation. But I really think that some of it may be technical factors. I think we don't take into account as much the technical factors as the depth of injection and the spread of injection and all those things as we really should. Because I think it's, when I do it, my fellows do it with me, and they'll tell me that I do it a little differently than my partners. So I think that may be part of it.
And you had 10% as surgery. What was that?
That was bladder augmentation. Some of them actually had mixed incontinence, so went on to a sling, those sorts of things.
Magnus? No? Okay, thank you so much. So